Hi everyone, Dr. Timothy Gallagher.
Dr. Michael Marciello.
And we're from Maragal Medical. Well folks, the leaves are falling, the golf courses are wrapping up. Big shout out to St. Bernard's High School in their state championship appearance. My buddy Matt Husk and Pat Kennedy, great job, as well as the rest of the St. Bernard's golf team. So we figured this week we'd talk to you about managing golf injuries. You're not going to want to miss this one, so stay tuned. Okay, Dr. Mike, we've been seeing a lot of our patients, the snowbirds, they're gearing up to, make the big trip down south. A lot of those patients are playing golf during the winter. And here, I know I just took out Ainsley a couple of weeks ago. We were on the golf course. And one of the things that kind of stuck in my mind is I spent a little extra time just kind of warming up on the practice tee. We're starting to notice a lot of folks coming in with nagging lower back injuries. So what are some of the things that we can do at our clinic to not only manage those injuries, but maybe even help those patients who are going down south to make sure that they have a productive golf season in the winter time and the warmer weather down there?
Sure. Again, I think the obvious from a golf play, if you just think of the mechanics, is a lot of torque. There's a lot of rotation that kind of puts a lot of strain to the hips, the lower back, and even the knees, depending on how you're turning. So we think about the same thing for anything that starting getting colder. The muscles get tighter, the body starts feeling like I'm a little stiff, and if you don't get your little pre-warm-ups, getting moving a little bit more so at the beginning, you can have a little bit more strain. And then what happens a little bit of time we play golf, or some of the just like weekend warriors, you go out and you try to hit it too hard, you try to just really go at it too aggressively, and you strain. So we're trying to reduce those aspects of injuries on the torquing aspects of the trunk and the lower back.
Yeah, and if you're noticing too, and if you're working with your pro and he's trying to work on, getting you to turn, and you notice that you can't turn, that's definitely an indication where, we could give you some instruction on improving your flexibility, your core strength on the physical therapy side. The chiropractors in the practice, the lower back adjustment is going to work really well, helping you improve that rotary component, which is so crucial to the golf swing. But we also notice other injuries, even upper extremity. You hit the ball fat and you get a lot of, big divot. Sometimes you can actually irritate the muscle on the inside of the elbow, what we call more of a medial epicondylitis as well.
Yeah, we always talk about golfer's elbow and tennis elbow. Well, many times the folks that don't play golf or don't play tennis to get these muscle strains, but they are exactly that. The medial side, the inner elbow, and that's called golfer's elbow. So again, you drive and we kind of get our hands and run to the club. It puts a strain in repetitive movement, especially if your technique's not wonderful, and you get a tendonitis and quite a bit of recurrent problem there. So now if you're lifting and carrying things, it may be a nag for a long time. Or if you mentioned, like you come in fat and you hit the ground hard, you really can get some kind of kickback on the shoulder. If someone has an underlying little bit of a shoulder problem or some strain before, you can really re-aggravate that from hitting the ground and hard. And again, especially around here in the Northeast, the ground gets harder, you can certainly get a little bit more, again, difficulty getting through the ground. And then also in the Northeast, we think about that morning dew. The grass gets slippery. It gets a little bit slick, and so we have to think about how are we planning and are we walking the course and going to cause little slips and little kind of injuries. We have to be careful.
Yeah, those are great. And we've also noticed too that there's a lot of patients out there that really enjoy walking the golf course. Getting out there, walking those 18 holes, but then all of a sudden the knees flare up and they're finding themselves, using more of the cart, and they're missing out on that extra exercise that they're getting out because their knees are bothering. There's a lot of things that we can do to help those patients improve the pain from arthritis in the knees too, right?
Absolutely. So every joint that gets moving, especially with the amount of motion that takes place in a golf swing, we have to just keep a person moving. Again, address their joints, knees, hips, ankles, and of course, as the back, as we mentioned. So we really want to keep it as a full person mobility and activities to keep them in shape.
Yeah, that's great. In our clinic, we're Maragal Medical. We combine medical care, physical therapy, and chiropractic treatment under one roof. We have a special interest and expertise in the field of regenerative medicine, now covered by Medicare. If you want to learn more about our practice, feel free to check us out at the web at maragalmedical.com. Well, that's it for today. I hope you all learned something. We'll see you again soon.
Take care.